All right, my friend, we're live. I'm kind of new with this tripod. I'm gonna sit over here. This is the problem we had was a lot of people complained that we were too wobbly just holding the camera,
Right.
so we use that. You can look over here at me or over there at the
Okay.
camera. I know that you and I just kind of discussed some of the things you've been through,
Right.
but I think some of our fans will find what's happened to you really very fascinating. So I appreciate you being willing to share with us.
Absolutely.
So just so everybody knows, you're okay if we video you for YouTube?
Yeah,
and
we're
everything?
cool.
You're cool with that. Tell us real briefly some of your big highlights in your medical history.
Yeah.
Oh, and we're gonna call you Colorado. Since
That'll
you're in
work.
Colorado there.
I had gained some weight in the spring and had not really followed up. I hadn't really kept up with my blood pressure like I had. And I went to a funeral of a friend who committed suicide.
Ooh.
Very traumatic, kind of a deal for me, a mentor figure. And the next day I started feeling some flu-like symptoms. And then a couple of days later, I had a stroke. And I had a stroke in the pons area.
Part of the brain that involved. Okay.
Yeah, the doc says the two arteries from both sides kind of come down and meet in that 4-lane highway. And he was shocked because he thought, how in the world can you even be speaking or not be bedridden?
Right.
And I did experience weakness on my left side and a loss of balance and anxiety.
Okay.
But with exercise, the strength has come back almost completely. I'm doing yoga.
Right.
With my wife, I'm walking, and with the help of the meds that you've been giving me, clonazepam and other things, the anxiety has gotten much better.
Great. And you had a history of some prostate issues too?
I did. 6 years ago, I had my prostate removed.
You had prostate cancer.
I did.
Okay.
It was interesting, I went to a surgeon to have my colonoscopy done. He's a friend of mine up in the country in East Texas. And he looked in my eyes and he said, something looks weird. He said, I'm worried that you might have some kind of cancer. And I said,
Really?
and I have a history of colon cancer in my family.
I see.
So now I've got anxiety because I'm thinking colonoscopy, colon cancer. And it turned out that they did a complete physical and they did a PSA as a part of that.
Right.
The digital exam did not show
Right.
any swelling, but the PSA indicated it was 10.0.
Had you had any symptoms, having to get up, urinary frequency, getting up a lot at night, things like that, stream issues, anything like that?
No symptoms. The fortunate thing for me is I was 49. So the doc said, I know you're not quite 50 yet.
Right.
Which is kind of the recommended thing, I think. But with your family history, I'd really like to do that colonoscopy now. And had we not caught the prostate issue at 49, which normally I think at 50 is if I'm correct, 50 is when they kind of usually start the screening.
We used to. That's all changed now.
Wow.
We don't screen for prostate cancer anymore. And this is going to come as a shock to a lot of people. But about 3 years ago, the United States Preventative Services Task Force, the American Cancer Society, and the American Urological Society, as well as some other groups, all agreed that routine prostate cancer screening for men is not only not indicated anymore, it's actually bad. And the reason is we're more likely to find false positive tests on men in general than to actually find true positives. And that brings us, and it's a good segue into the real reason I wanted us to kind of share some stuff with our fans that you've been through here recently. Because here you are 55.
Sure.
You've already suffered. You've been through cancer. You've been through this stroke. And seeing me, we recommended a colonoscopy, right? Tell us what happened.
Had a colonoscopy, met the doctor at his office, and he works through a local hospital. And so I went there to the hospital, did not expect any complications, did the prep work, and after the procedure, felt pain in my upper abdomen.
Right.
And
So you had the colonoscopy done, and then something.
But
that wasn't your first colonoscopy, was it?
No, I've had several.
You've had several. So you knew, because of your family history, you're getting routine colonoscopy. All right. So you felt something different.
I felt different. I felt pain. And the nurse actually said something funny. She said, if you'll just go home and pass gas, you'll be fine.
Okay.
And I'm like, okay, I can do that much. But I went home and the pain did not go away at all. Matter of fact, I took some Advil and it went away for a little bit, but then when it came back, it was worse. And I told my wife about 5 o'clock, I've got to go back to the
Something's
ER.
wrong. Something's wrong.
And it was amazing. They went into this kind of emergency mode. They immediately did a CAT scan and said, you've got a perforation. They called in an emergency surgery team.
Right.
They've got this whole procedure.
Sure.
And they did a reparative surgery. 1 week after the surgery, I went home and was home for 4 or 5 days. And then during the middle of the night, had rectal bleeding. And then they had to take me back to the hospital.
To come loose.
And I was hospitalized again.
Let's show everybody the scar. You don't mind doing that, do you? I'm going to come back over here and see if I can't move this. So you guys can see our friend Colorado here. He had to have an open laparotomy. You had to have. Did they actually remove part of the colon?
No, they were able to. It's interesting. They gave me the actual report the doctor read, and they were able to actually staple the interior of the intestine with one large staple. So evidently the perforation was
wasn't that bad. It was just small enough to cause a problem. So. And this is what you and I were talking about before, and I was talking to you more from the standpoint of screening versus investigating a problem. Now, in your particular case, you were not having a colon problem, but we were doing colon cancer screening. And in your case, it's even more imperative that that be done because you have this family history of colon cancer. But you're one of the few that had the side effect, that didn't have the side effect. You had the complication, okay? You had a perforated colon. So anytime somebody does a colonoscopy, they need to be aware that this can happen.
Absolutely.
And this is where the statisticians, where the medical epidemiologists come in and say, all right, what tests, what screening should we be doing, and what screening should we not be doing? And they balance the benefit of all the lives that are saved against the cost of this kind of a complication. Whereas, like I mentioned to you, years ago I had a patient that actually passed away after a perforated colon. So that's how they make those decisions as to what's done and what's not done. And back to the prostate screening issue, that's part of the reason why we no longer recommend routine prostate cancer screening in men, because we have too many complications from what turns out to be unnecessary procedures. Anyway, man, I appreciate you sharing this with us. I think it's a great story and it's a great lesson for all of us to know that even though we're doing everything right, things can still happen.
I'm glad to get this opportunity. I did not post anything on Facebook at all because I didn't want to give anybody any kind of idea, okay, I shouldn't go.
Right.
That's a doctor's decision. That's not, I didn't want to influence people to say, okay, that could happen.
Right. And no, but I think people need to know it is a real complication. It's a real risk, but the benefit does far, far outweigh that risk. And even though in your particular case, this has happened to you, will you get another colonoscopy in the future?
3 years.
In 3 years, you'll be back to get another colonoscopy.
Absolutely.
Because you still, despite all of this, it's still the right thing to do.
Yeah, they removed 5 polyps. And in my case, my grandfather died of colon cancer. My father had colon cancer. So, you know, when you're able to remove 5 polyps at 55, I know that buys me
it buys you time.
3 more years.
Who knows? More. And so this will go on YouTube soon. When it does, you can find my site and you'll be able to post this video on your Facebook feed for all your friends and family to see, and so the whole discussion is there.
That'd be great.
Colorado, you're awesome, man. Thanks for sharing.
Thanks, Doc.
All right. No more freshening up. Okay, tell us about Meta 7.
It gives me great energy. When I take it, I was shocked. I take it, and I have energy the whole entire day. I feel like running a marathon half the time.
Really? You feel good,
it's like way better because I was super fatigued before.
Okay, and so tell us, is it natural feeling energy or is it jittery, shaky?
No, it's natural. It's not jittery at all.
And focus?
Yeah, actually my focus is better as well.
Yeah,
I didn't notice that, yeah.
Okay, well thanks. You're on, let's go.
Hi everybody, I'm one of Dr. Gilmore's patients and I've been taking Meta 7 and for 3 weeks now, and I feel like it's given me more energy. I feel like I can get through the day. It's helped me with a lot of things that I've been having issues and troubles with, and I feel great.
Wonderful, thanks.
Thanks.